Hi everyone. In this video you will see the high yield gross spotters in each region. Coming to upper limb, you have to know the following muscles. Deltoid. It is a thick triangular muscle which originates from spine of the scapula, acromion process, clavicle and insert into deltoid tuberosity, main abductor of arm, and it is supplied by axillary nerve. Coming to pectoralis major, it is a fan-shaped muscle which forms the anterior axillary fold. It originates from clavicle, sternum, costal cartilage and inserted into intertubercular sulcus. Coming to supraspinatus, originate from supraspinatus fossa of the scapula, and infraspinatus originates from infraspinatus fossa of scapula, and both they inserted into tubercle of humerus, and it forms a rotator cuff muscle. Coming to serratus anterior, originates from the ribs and inserted into medial border of scapula. The nerve supplies long thoracic nerve, that is nerve to serratus anterior. If it is damaged, the condition is called winging of scapula. Biceps brachii have short head and long head. Short head originates along with coracobrachialis from coracoid process of scapula, and long head from supraglenoid tubercle and inserted into radial tuberosity, action supinator and flexor. Brachialis lies deep in the anterior compartment and it is a chief flexor of elbow. These two muscles is supplied by musculocutaneous nerve. Coming to pronator quadratus, deepest muscle in the anterior compartment of forearm, and its origin is from ulna, insertion into radius. Nerve supply is anterior interosseous nerve. Coming to supinator, wraps around the upper radius and posterior interosseous nerve pierce it. It is more vulnerable in the fracture of radial neck. Coming to lumbricals, or four small muscles, and it helps in flexion of metacarpal joint and extension of interphalangeal joints. Anconeus is a small triangular muscle from lateral epicondyle of humerus to olecranon. Adductor pollicis has two heads, oblique and transverse head, which is related to your thumb. It adducts the thumb and supplied by ulnar nerve, and it is more relevant for 4-month sign. Brachialis lies deep to biceps, and it inserts into the ulnar tuberosity. Coming to flexor and extensor retinaculum. Extensor retinaculum of the arm have 6 compartments. You have to know which muscle in which compartment. Coming to quadrangular space, lower triangular and upper triangular space, I am just going to tell the boundaries of these spaces. Long head of triceps, humerus, teres minor and teres major. Quadrangular space transmits axillary nerve and posterior circumflex humeral vessel. Lower triangular space transmits radial nerve and profunda brachii artery, whereas upper triangular transmits circumflex scapular artery. Coming to cubital fossa, anatomical snuff box and radial groove. Radial groove lodges radial nerve and it locates in the posterior side of humerus. Cubital fossa is a triangular area in front of elbow, and it has the contents of cubital fossa is biceps tendon, brachial artery, median nerve and superficial branch of radial nerve. Anatomical snuff box, where the scaphoid bone is palpable and the content is radial artery, superficial branch of radial nerve. Median nerve formed by lateral and medial cord of brachial plexus, and it runs through carpal tunnel. So carpal tunnel syndrome, you have to remember median nerve. For ulnar nerve, passes posterior through medial epicondyle funny bone, and it supplies most of the intrinsic hand muscles. If there is a damage, you have to know the claw hand. Coming to radial nerve is a continuation of posterior curve, and it is the biggest nerve of brachial plexus. It spirals around the radial groove, and if it is injured, you have to remember wrist drop, and the clinical is Saturday night palsy. Musculocutaneous nerve pierces brachioradialis, supplies the anterior arm flexors, and it continues as lateral cutaneous nerve of forearm. Radial artery is a terminal branch of brachial artery. It forms deep palmar arch. Ulnar artery continues as superficial palmar arch. Brachial artery is a continuation of axillary artery, and at neck of the radius that terminates into radial and ulnar artery. Gluteus maximus is the largest gluteal muscle, originated from sacrum ilium from posterior sacral line. Main hip extensor, and it's inserted into iliotibial tract, and IM injection site. It is most common for IM injection, and it is supplied by inferior gluteal nerve. Coming to iliotibial tract, it is a thickened fascia lata, and tensor fascia lata is inserted into iliotibial tract. Inguinal ligament attachment, anterior superior iliac spine to pubic tubercle. It forms the boundary of femoral triangle. Coming to sartorius is the longest muscle. It also called talus muscle, which cross both hip and knee joint. And quadriceps femoris, you have four muscles: rectus femoris, vastus medialis, vastus intermedius, and vastus lateralis. Ligamentum patellae is a continuation of quadriceps tendons below the patella to tibial tuberosity. And great saphenous vein originates from dorsal venous arch, and it drains into femoral vein at saphenofemoral junction through saphenous opening. It is the vein more commonly used in CABG graft. Coming to popliteal fossa, it is a diamond shaped fossa behind the knee. It contains popliteal artery, vein, tibial, and common peroneal nerves. Coming to gastrocnemius and soleus, it forms calf muscle, which is triceps surae, and inserted via tendo Achilles. Popliteus helps to unlock the knee, very important, and tendo Achilles is the thickest and strongest tendon, and it is inserted into calcaneum. Coming to femoral artery is a continuation of external iliac, enters via femoral triangle, and at midpoint of inguinal ligament it is palpable. Femoral nerve from lumbar plexus supplies anterior thigh muscle. It has anterior and posterior division. Saphenous nerve is a branch of femoral nerve. Coming to sciatic nerve, it is the largest nerve in the body and exists via superior sciatic foramen. Very important. Greater sciatic foramen, and splits into tibial and common peroneal usually at the popliteal fossa. If there is an injury, it causes foot drop. Coming to peroneus longus and brevis, it's the lateral compartment muscles, averts the foot. In thorax, you have to know lung, heart, trachea, esophagus, and diaphragm. Lung, you have to know the fissures, and hilum. Hilum is the place where the structures enter, that is, root structures enter and exit. Lingula is present in left lungs, tongue-like projection, and impressions for arch of aorta, azygos vein is seen on the medial surfaces. Pulmonary ligament is below the hilum, allows for lung expansion, which is also called dead space. And in heart, anterior interventricular groove have LAD, which is left anterior descending artery. Posterior interventricular groove have posterior descending artery. Coronary sulcus separates atria from ventricle and has coronary sinus. Ascending aorta arises from left ventricle, and the branches of ascending aorta are right and left coronary artery. Arch of aorta gives three branches: brachiocephalic, left common carotid, left subclavian. Pulmonary trunk arises from right ventricle. Inside the right atrium, you have sulcus terminalis and musculae pectinati. Outside, you have inside is crista terminalis. Outside, you have sulcus terminalis. Please make a note. Inside the right atrium, you have crista terminalis. Outside, you have sulcus terminalis. Trachea is she-shaped cartilaginous ring, fibricates at sternal angle, that is at the level of T4 into right, which is wider, short and more vertical. It is common site for foreign body, and left main bronchi. Esophagus is a muscular tube. You have to know the constrictions, where you have cricopharyngeal constriction, aortic or bronchial constriction, and diaphragmatic constriction. This is clinically relevant for foreign body impaction. And for diaphragm, that is a musculotendinous partition in open air, that is T8, T10, T12. In means IVC, open esophagus, A for aorta. For abdomen, you have to know the liver. Hilum of the liver, which has porta hepatis, entry of portal vein, hepatic artery, and exit of bile duct. It has right, left, caudate and quadrate lobe. Quadrate lobe is related to pylorus of stomach. Falciform ligament is anteriorly attached to anterior abdominal wall. Contains ligamentum teres, which is the remnant of umbilical vein. The parts of gallbladder are fundus, body and neck. Stomach has lesser curvature, greater curvature, and fundus placed superiorly and pylorus inferiorly, which opens into duodenum via pyloric sphincter. You have to know the attachment of lesser and greater curvature, which is lesser and greater omentum, and it has vessels. Hilum of spleen is on the medial surface where splenic vessels enter. It has gastric, renal and jejunal impressions. And coming to hilum of kidney, you have to know the arrangement. Front to back, you have renal vein, renal artery and renal pelvis, and you have to know the constrictions of ureter, which you have three constrictions. One is pelvoureteric constriction, and at the level of pelvic brim, and at where the ureter enters the urinary bladder. Coming to duodenum, you have four parts: superior, descending, horizontal and ascending parts, which forms a she-shape around the pancreatic duct. Major duodenal papillae opens into second part of duodenum. Coming to pancreas, you have head, neck, tail, and it has both exocrine and endocrine glands. So abdominal aorta begins at T12, bifurcates at T4 into common iliac arteries, and it has paired and unpaired branches. It mainly gives to celiac trunk, superior mesenteric artery, inferior mesenteric artery and renal artery. Coming to pelvis, you have to know the uterus, parts of the uterus. It is pear shaped, it has fundus, body, cervix, and parts of fallopian tube. You have infundibulum, ampulla and isthmus. Ampulla is the common site for fertilization. And coming to ovary, it is almond shape and it is medial to fallopian tube, and it contains follicles at various stages. Coming to trigone of urinary bladder, which is a triangular smooth area on the posterior wall bounded by two ureteric opening and internal urethral orifice. Prostate surrounds the prostatic urethra below the bladder neck. Benign prostatic hypertrophy compresses the urethra, causing outflow obstruction. Coming to retrouterine pouch of Douglas, deepest peritoneal pouch in female pelvis between the rectum and uterus. It's a site of fluid, blood and pus collection. Testis is covered by tunica vaginalis. It produces sperm and testosterone. Coming to spermatic cord, it contains vas deferens testicular artery, papilliform plexus, and it passes through the inguinal canal. Now coming to head and neck, sternocleidomastoid divides neck into anterior and posterior triangle. Torticollis occur if it is shorter. The origin of sternocleidomastoid is sternum, clavicle, and inserted into mastoid process. And digastric have two belly, anterior belly and posterior belly, and it is inserted into common tendinous ring sling, and anterior belly from first pharyngeal arch, posterior belly is from second pharyngeal arch. So anterior belly is supplied by mandibular nerve, posterior belly is supplied by facial nerve. And mylohyoid forms the oral cavity floor. Coming to thyroid, it is a butterfly shape, has two lobes, isthmus over second to third tracheal rings, and it is wrapped by pretracheal fascia, and it moves with swallowing. And you have to know the relation, artery and nerve relation, and apex and base. And common carotid artery has no branches in the neck, bifurcates at C4, you have to know, whereas abdominal aorta bifurcates at that is terminates at L4. Here common carotid bifurcates at C4, upper border of thyroid cartilage, into internal and external carotid. External carotid artery supplies face and scalp. And coming to facial artery, you have to know it crosses the mandible bone, and you have to know the branches of facial artery. Coming to parotid, is the largest salivary gland. It is anterior to ear, and stensons is the duct which crosses the masseter, and it pierces the buccal pad of fat, buccinator, buccopharyngeal fascia. Facial nerve, external carotid artery and retromandibular vein lies in the facio-venous plane of Pattis, and the duct opens opposite to second upper molar. Masseter is a powerful muscle of mastication. It helps in closing jaw. Orbicularis oculi, you have to know the three parts of orbicularis oculi which helps in closing the eyelid, and orbicularis oris helps to close the lip, and it is supplied, both orbicularis oculi and oris is supplied by facial nerve. Coming to nasal septum, you have to know nasal septum is formed by a perpendicular plate of ethmoid, vomer and septal cartilage. You have to know the blood supply, nerve supply, Little's area, Kesselbach plexus. Which artery doesn't involve in Kesselbach plexus is posterior ethmoid artery. And you have to know the concha and meatus. You have a superior concha, middle and inferior concha. Posterior ethmoid air sinus opens into superior meatus. Frontal, anterior ethmoid, middle ethmoid into hiatus semilunaris, middle ethmoid air sinus into bulla ethmoidalis, and inferior meatus you have nasolacrimal duct. And you have to know the soft palate, muscles of soft palate, and tongue you have to know the intrinsic muscle, extrinsic muscles. Genioglossus is a safety muscle, helps in protrudes of tongue. And you have to know the sensory and motor supply of tongue. Coming to neuroanatomy, you have to know the corpus callosum, which is the largest commissure, connects to cerebral hemispheres, has genio, body, rostrum and splenium. Coming to central sulcus, separates frontal from parietal lobe, whereas lateral sulcus separates temporal from frontal and parietal lobe. Coming to cerebellum, has two hemispheres with vermis, helps in coordination of movements and balance. For basilar groove in pons, we have basilar artery, and medulla oblongata continues as spinal cord below the foramen magnum, and it has cardiorespiratory centers. You have to know the olive and pyramid, which are located in medulla oblongata. And interpeduncular fossa is between the cerebral peduncles at the base of midbrain. Oculomotor nerve emerges there. And for lateral ventricle, you have to know the lateral ventricle parts, and it is C-shaped cavity in each hemisphere which produce and circulates CSF via choroid plexus. That is important, and it is connected to third ventricle via interventricular foramen of Monro. Spinal cord, you have to know the extent, and from C1 to L1 or L2 at adults, and it ends as conus medullaris. Cauda equina, the nerve roots below L2 is called cauda equina, and it is 45 centimeter long. Blood supplies via one anterior and two posterior spinal arteries from vertebral artery and segmental radicular arteries. You have to know the largest radicular artery. Okay.